Hello, and welcome to the Mysteries of the Pelvic Floor following childbirth. My name's Julia Herbert, and I'm a consultant physiotherapist in pelvic health. And I'm also the clinical director at a company called Femida, who are the manufacturers of a new pelvic floor muscle training device, which we'll talk about a little bit later on. Today, I'd like to talk to you about what happens to your pelvic floor during pregnancy and delivery, and where many of you will be at now, the mysteries of the pelvic floor after childbirth. If you have any questions as we go through this presentation, then please do contact us. We're going to collect them all up and deal with them at the end of this video broadcast. And so do keep looking on Instagram, and hopefully we'll have your answers posted there for you. When I think about the mysteries of the pelvic floor post-childbirth, I often think about this picture that somebody once sent to me. I'm not sure whether it's very clear on the screen, but it's a picture of an ostrich having a look between its legs. And the reason I think of that is because it's really hard to know what's going on down there. And how do you feel things down under once you've given birth? Even if you've had a cesarean section, things will not necessarily be the same. The baby comes out through your tummy, but you've been pregnant for 9 months and had pregnancy hormones and the weight of the baby growing inside you. So your pelvic floor might not be the same after a cesarean section. And especially those of you that have had a vaginal delivery will be noticing things might feel a little bit different. Unfortunately, I think some of us get patted on the head after we've had our babies, given a leaflet that says this is how to do your pelvic floor exercises. It talks about fast and slow exercises, and off you go. And if you're lucky and you can do them properly, then you might manage to do them for a little while when you first get home and everything's very new. But how many of you have actually stuck to doing a regular pelvic floor exercise programme? When I first started working in one of my NHS jobs, I asked a lot of women in the postnatal groups that I used to teach at how long they carried on doing pelvic floor exercises 3 times a day when they got home, and the average time was about 2 weeks. So we don't do so well at these pelvic floor exercise regimes. But the other problem we have is knowing if it's feeling right down there. A lot of the patients that I've seen in my NHS practice over the years have come to me after having a baby saying, oh, it just doesn't feel right, it feels different, it feels too big, it feels too lax, it feels lumpy, I don't feel sexy anymore, what's going on? And then some women actually make the fatal mistake of trying to be the ostrich, but because we can't reach down between our legs, they actually get a mirror out and they lie on the bed and they get a mirror and they have a look down there and they think, oh my goodness, is that really what it should look like? Often I say to patients, did you ever have a look before you had your baby? Because you might actually look the same. It often feels very different, but it might not look that different. But a lot of women do worry about how it feels and how it looks. So a great resource, and we'll post these online after this session, is a tool that I tell a lot of women about, which is called the Great Wall of Vagina. It's not actually a lot of vaginas, it's a lot of labias or vulvas, which is the other name for labia. An artist called Jamie McCartney actually took plaster casts of over 400 women, and they're all arranged in this moulds of plaster casts in a photo image of lots of different shapes and sizes. So if you want to know whether you're part of the normal range, just take a look at that online and it'll hopefully reassure you. It's quite fascinating. And actually there's a lot around. If you start to look on the internet, there's another author called Laura Dodsworth who's actually talked to 100 women, and many of them have allowed her to take photographs of their labia or vulva and their vagina and tell their story. And that's actually now in a book called Womanhood, The Bare Reality. So that is actually a really good resource too, to actually know what things should look like down there. But back to the, it doesn't feel right. Well, that may be because your pelvic floor has changed. We've already mentioned that just being pregnant actually puts a load on the pelvic floor. The hormones make things more stretchy, so the fascia that supports the muscles in your pelvis actually becomes quite stretchy with the pregnancy hormones ready to be able to give and let the baby out if you have a vaginal delivery. And of course most of you will have put a little bit of weight on while you were pregnant as well, and that's going to load onto your pelvic floor. So when we've actually had a baby, we do need to do some training of the pelvic floor muscles. But there's quite a lot of challenges there. As I started off by saying, lots of women don't actually do them for long enough or remember to keep doing them. It's going to take about 3 months to train these muscles effectively, and for some women maybe longer. But the challenges are quite big. You might have just had that leaflet. You might have actually not had anybody explain it to you. Have you actually tried doing pelvic floor exercises, or is it just something you keep meaning to get round to and haven't quite done it yet? And when you squeeze, are you squeezing the right thing? I can remember going to a number of different Pilates classes and the Pilates instructor saying to women, and squeeze your pelvic floor and pull in these muscles and get your core working. And a lot of confused faces around about going, I'm not sure whether I squeezed the right thing. So common mistakes are actually that you hold your breath, that you take a great gasp of air in and try and hold that breath and pull everything up. And actually what you can end up doing is holding your breath and bearing down and pushing down on those muscles. So try not to take such a deep breath in. Some of you will actually squeeze your bum muscles together, your gluteal muscles, and that will feel down in the right area. It's down between your legs, but it's actually not actually your pelvic floor that you're squeezing. And sometimes just squeezing your thighs together or clenching everything tight and not actually lifting inside. And if you pull your tummy muscles in as if trying to do a sit-up, so really stretching those long rectus abdominis muscles and contracting those and pulling everything forwards, is another big mistake. It's okay that some muscles move, and maybe a little bit of glutes or a little bit of your lower tummy muscles, your transversus abdominis goes right round you like a corset. That's meant to work with your pelvic floor. Your pelvic floor is part of your core muscles, so when you get told to do it in Pilates, that's the right thing, but the hardest thing is to get the right muscles to work first. So I've got a little model that I show patients, which is of your pelvic floor. It's not the anatomical model that some of you might have seen already, but it's a little shape of a pelvis. That bit at the front would be the bone between your legs, and this bit at the back is where your coccyx is. And the pelvic floor is all the coloured bits of muscles underneath there that actually supports everything from underneath. And to do these exercises effectively, you need to do them 3 times every day, and you need to stick at that for a good 12 weeks to strengthen a weakened pelvic floor. And especially if you've had a vaginal delivery, your pelvic floor will have had some stretch on it. It may have even had some injury. You may have had a tear, or you may have had the cut, the episiotomy, and had some stitches. If you've been really unlucky, you might have had a more severe degree of tear. We call that a 3rd degree tear or a 4th degree tear. That's quite a significant tear that's extending back towards the muscles around the back of your pelvic floor to the muscles around your bottom, your anal sphincter, and that can get damaged with a 3rd or a 4th degree tear. Any kind of delivery, even as I said, a caesarean section, you're going to need to do your pelvic floor exercises. So how do we find the pelvic floor? Well, we've got some social media posts around out there, but if you haven't seen those yet, then let's go through some tips that might help you. One of my colleagues did some research work for her PhD and actually tested the best instruction to give a woman to tighten the correct muscles. And she found that tightening your back passage, so imagining that you're going to pass wind and you're just about to meet somebody very important or go on your first date or meet the in-laws, and you really don't want that noise to come out and that smell to come out, tighten your back passage up. That will start the back bit of your pelvic floor around your anal sphincter. Then what you need to do is to pull from your back passage upwards and forwards as if you're lifting round. Now, a colleague I teach with actually says it's a bit like a banana. Start at the back passage and zip that banana together right round to the front. So it's the idea that you're squeezing and lifting upwards and forwards, and that should get the right sensation to happen. But if when you've given birth you can't feel things very well down there, you're just not sure what you're squeezing, your brain is actually not talking to your pelvic floor at all, and you've lost that connection, then giving another sensation going in to actually tighten your pelvic floor muscles, it might help if you just roll up a hand towel and sit over that if it's comfortable, to get some pressure on what we call the perineum, the bit between your front and back passage, and just try and lift those muscles up, still thinking about squeezing the back passage and pulling forwards, but trying to lift the pelvic floor up from the rolled up towel. That might just help as well. If you have done the mirror check and you've got a mirror handy, you could actually have a look to see if these muscles are working. So if you lie on the bed and place your mirror at an angle that you can see the skin between the vagina and the anus, you should see some movement up towards your body as you're doing your pelvic floor. What you don't want to see is that you're pushing down. If you hold your breath, you quite like to bear down, and quite often that's referred to as doing a Valsalva. It's the same kind of movement you would do if you were pushing your baby out, and clearly that's not what we want you to be doing when you're doing these exercises. We want you to be drawing upwards and inwards, upwards and forwards towards your head and towards your tummy. The final way that sometimes I tell people to actually find their pelvic floor is if you do get a chance to have a soak in a nice warm bath, or you can do this in bed if you're comfortable doing it, is to actually just use your thumb. It's the right way round to just fit down between your legs and actually imagine that's the vagina, and you just put your thumb inside the vagina just a little way in, and then when you squeeze your pelvic floor you should actually feel some lift and squeeze of your thumb as if you're drawing your thumb up inside you. So that's the first thing to try, to make sure that you're squeezing the right thing. There's a lot of other muscles down there in the pelvis and attached to the pelvis that unfortunately you quite often squeeze as well. And I always think of one of the ladies I talked to once in a postnatal group who was really desperate to get back to being a Keep Fit instructor. So she was working her pelvic floor like mad, and she told me she got earache when she was doing her pelvic floor exercises. And I said, earache? You shouldn't get that. And what she was doing was actually trying so hard. She was tightening everything here and clenching her teeth, and it was giving her earache. So don't get earache, and don't lift your eyebrows up necessarily. People will know what you're doing if you lift your eyebrows up. So let's assume you've found your pelvic floor, that we know that it's tightening when you do this. Then what do you need to do when you do your exercises? As I've said already, you should do them 3 times a day, but each time you do a set of exercises, you need to think of 2 different ways of moving that pelvic floor. The first exercise is what we call slow contractions or endurance training, and that will actually train the muscles that you will use when you need to hold on when you need a wee, or if you need to go to the toilet for a bowel movement. It gives you that ability to hold on for a length of time. Those are the muscles that you need to have fit if you're going to start running. If you're going to actually go on a 5k training run or longer even, then you need to have that endurance in your pelvic floor that it can sustain and support you whilst you're out running. So to do these exercises, you squeeze your pelvic floor as I've just told you about, and then you try and hold that squeeze steady for as long as you can, aiming to get to 10 seconds if you can do. Now, to begin with, you probably won't get anywhere near 10 seconds, especially if you've not long had your baby. So hold for as many seconds as you can manage, even if it's only 2 or 3. Then it's really important to let those muscles relax. What we don't want is a pelvic floor muscle that's got tighter and tighter and tighter and tighter and doesn't know how to relax. Healthy muscles can both contract and release and relax. So make sure you give yourself time to relax, usually about 4 seconds, and then try that squeeze again. And the idea is that you do as many of these long held squeezes as you can manage, aiming to do 10 squeezes and hold each one for 10 seconds. Once you've done as many as you can for as many seconds as you can, then you will have fatigued your endurance muscles. So that's the first part of your pelvic floor exercises. Give yourself a little breather for about a minute, and then try doing the same squeeze again, but this time do it really strongly and quickly, and then let go straight away. And these are the power contractions. These will train the fast fibres in your pelvic floor. And these are really important when you suddenly move, or you cough, or you sneeze, or you laugh, or you jump, something that increases the pressure in your abdomen suddenly, then these muscles are your firefighter muscles, your power muscles that really need to come in and stop that leakage. The aim here is to do a strong contraction and then make sure you completely relax it again. Again, the relaxation is really important. And to do as many of those as you can, trying to get to 10. So your gold standard, if you like, is to do 10 slow squeezes, hold for 10 seconds each time, and then to do 10 fast squeezes. And that's your pelvic floor workout. And we would suggest that you do that 3 times every day. Okay? Now, if you've seen any of our social media from Palviva, the My Palviva social media has actually got a campaign running at the moment called #StopSqueezingSelfie. And unfortunately, there's a picture of me in the garden on Bank Holiday Monday doing my squeezes. But really what we want to do is to get women into the really good habit of doing their pelvic floor exercises 3 times every day whilst we're in this lockdown. And then when hopefully very soon this lockdown finishes, then we can get back to our normal everyday life and work and care and schools and everything else gets back to normal. Hopefully we've got a good habit that we'll still be doing our pelvic floor exercises regularly. Now, if you've listened to what I've just said and you think, yep, been there, tried that, still don't know what I'm doing, then it would be really helpful to see a women's health physiotherapist. There's a large group of us across the UK, and this site that's hosting me today is run by the Mummy MOT, and a lot of you will know Mummy MOT, and thanks to Maria Elliott, who runs Mummy MOT, and all her colleagues there who've helped us to put this together. But through their network, they can put you in touch with a women's health physio. There are women's health physios in the NHS. At the moment, they're really struggling to have clinic appointments. That's all been stopped, and many of them have been redeployed to help with the coronavirus outbreak. But there are still physios available to do online consultations, and certainly the network of Mummy MOT practitioners are very much moving into doing that. There's a lot of them offering online consultations. So if you want to have contact with a Mummy MOT practitioner and find out how you can see somebody, then contact us through this Instagram or contact the Palviva email jane@palviva.com, and we'll put these up at the end so that you've got those links to be able to contact people, and they'll be able to put you in touch with either somebody near you or somebody that's online that can do an online consultation for you. So please don't struggle on your own. Women's health physios, pelvic health physios, sometimes we're called, can actually be really helpful for you. Now, there are other things that can help. If your pelvic floor is really weak, then one of the main things that you might find you're having problems with is your bladder control. That if you cough or sneeze or you need the loo and you can't get there in time, then you actually need to get some control over that situation while you get better. And it will take time doing your pelvic floor exercises. Unfortunately, they don't happen and work overnight. So you may have seen some of the adverts on telly targeted at postnatal mums for incontinence pads. As women's health physios, that's not our favourite route. It is a good way of coping with the leakage and containing it while you get sorted out, but certainly it shouldn't be seen as a long-term strategy. One of our favourite things is to offer an exercise app, and there are lots of pelvic floor exercise apps out there. So do take care and have a look. The NHS do have a recommended list. One of the apps that's on their list is the NHS approved Squeezy app. So we know that one quite well. One of our women's health physios actually put that one together. But there are others out there as well that might help you. I think if anything, the apps are good at reminding you to do the exercises, and you can often find ones that you can put your how long you can squeeze for and how many you can do, so you can actually follow a little routine, and that keeps you on track. You may or may not have heard of other treatment devices. Another category that we talk about are biofeedback devices. Quite a lot of these have been developed over the last 3 or 4 years, and they include things that you pop in your vagina, and then they're smart devices that you can Bluetooth to your smartphone, and then you use an app on your smartphone. So it actually sees your contraction and then tells you how well you're doing on your phone, and you can follow an exercise program on there. Now they can be really useful and again keep you on track, but with both just the online apps and these biofeedback device apps, you need to be able to do a pelvic floor contraction first. So if you're struggling with that, then they're not going to be suitable for you just yet. Another technique that's been used by women's health physios for quite some time is using electrical stimulation. And again, you can see some devices online. It's been around. I've been working for over 30 years in pelvic health, and we've had muscle stimulation all that time. But in the last few years, there's been a huge development, and that's the product that I'm going to talk to you about a little bit later, because it's taken away all the difficulties of knowing how to use the device, how to turn it up, which program to choose, depending on what type of incontinence you've got, because the new product we've brought out, which is called Pelviva, actually will do all that thinking for you. So I'll talk about that shortly. The problem with some of these devices is that if you haven't got anybody helping you with them, they can be a little bit difficult to understand. So again, the online physio consultation, if you've already bought some of these or been recommended them, then they can help advise you how to use them to their best effect. So I'm just going to talk a little bit now about Palviva. So if you go on pelviva.com, you can find out a lot more about the product. That's what the box looks like, and that's just a week's pack. That's got 3 devices in it, and each Palviva looks like this. So a bit like a tampon, slightly bigger than a tampon, but the good thing is it's made of foam, so it's actually soft and squeezy and quite compressible. The design brief, when we sat down around a table quite a while ago now to put this together, was that it should be very easy to use, that it should be comfortable for women to actually fit into their everyday life, and most importantly, it should be effective in what it does. We made it so that it's single use, so it's foam and you don't have to wash it or clean it or store it after you've used it. You just can dispose of it in the normal household waste. And when it's actually in use, the whole Palviva device goes inside the vagina. So a lot of the other things that I've mentioned already, you will be connected with a wire or with some sort of probe sticking out of you while you're actually using your smartphone app or connecting to a conventional stimulator. The difference with Palviva is it goes completely inside, so you can sit down, you can sit on an exercise ball, you can sit and do your emails. We even had women in our clinical study taking the dog for a walk or going to an exercise class while they were having their Palviva treatment. And just recently, one of the mummy MOT physios has been having a go with Palviva herself, and she said, oh, it's great, I can walk around, I can do my exercises, I've been lunges and squats and actually been quite active while she's been having her Pelviva treatment for her pelvic floor. So that's definitely the aim behind the device, that it's easy to fit in. Each device is automated, so you don't have to think about any dials or controls. That's what makes it so easy to use. And the treatment from one device lasts 30 minutes. To actually use Palviva, all you need to do to actually switch it on is pull out this little pull tab. It just pulls out quite gently, a bit like starting a kid's toy or taking the seal out of a watch battery, and that can then actually switch on the battery inside of this that turns up the stimulation. It's a little electrical pulse that's emitted from the device. We supply it with a tube of Optilube gel, which is a water-based lubricating gel. You just put a dip of gel on the head of it and then you put it inside in the same way that you would put a tampon in, but it sits just a little bit lower than a tampon would sit. It should go inside the vagina by about 2 centimetres, so you don't feel anything but the removal cord sticking outside of the body. So it's discreet, nobody else will know you're using it, and it's comfortable. You can actually sit down on a hard seat and you're not going to feel like you're sitting on something uncomfortable. The treatment programme that we tested in a clinical study was using Palviva every other day for 12 weeks. But we have had a market research study where ladies using Palviva every other day found that after 3 weeks of using it, 80% of them said they were already seeing quite significant improvements in their bladder control. Things like not being woken up as often at night or not at all at night to go to the loo, being able to go out without a pad on even quite early on. But it does depend on how strong your muscles are, and it depends on how much exercise they're going to need. So we recommend the 12-week treatment. That's what we got the clinical data on. Now, I know some of you in the audience today will have only just had your baby, and we do suggest that you just start with pelvic floor exercises in the first few weeks. We would recommend that you wait 12 weeks before you start doing any electrical stimulation. We need things that have been stretched and maybe been a little bit damaged to heal well, so that before this exercise starts making it work for you, the structures are nice and sound and well healed. So just give it 12 weeks and then you can start using Palviva. If it's a little while since you've had your baby, you might be planning baby number 2, then make sure that if you think you're pregnant, then you don't use Palviva. We don't recommend using it whilst you're actually carrying your baby. So it's fine to prepare for it, but not whilst you're pregnant. Now, there are some other frequently asked questions that people might want to have answers to. There's quite a lot of those answered on the website, so you can go to pelviva.com and go to the frequently asked questions section, and that will tell you about some of the other conditions that you should be careful with using it when you've got health issues. We also have a customer care service centre, and we have ladies there who will actually be able to talk to you. So I'll tell you a little bit more about that as we go through. So the customer care team are available on the phone. So we have an 0800 684 6008 number, and that's going to come up on the feed for you. And also the jane@palviva.com email will allow you to get in touch with the team at the customer service centre. If you go on the website, you can see there's a live chat function on the palviva.com website, and again, Bridget or Sam will be available during working hours to actually have live chat with you and answer your queries there. So I hope you found that interesting, and I'm going to admit now this is the first time I've ever done an Instagram live, so I didn't think about saying that at the beginning, but I thought no, maybe say it at the end. So I hope there's not been too many ums and ahs as we've gone through. But if you stayed with it and you're interested in having a look at Palviva and you think it's for you, then as a thank you for sticking with it, we'd like to give you a discount of £25 off your first purchase over £100 of Palviva. So the code to do that is April 25, and again we'll put that online for you. But if you go to the buy now page on palviva.com, and when you get to the shop page put April 25 in, you'll get £25 off if your order's over £100. So if you like what you've heard, hopefully there'll be some more. I hope I get asked back, and we'd like you to follow us on Facebook or Twitter or Instagram at mypelviva. And don't forget, if you are doing your pelvic floor exercises, then go online and post a selfie on our Stop Squeezing Selfie campaign. Take care, stay safe in these troubled times, and hope if you have got little ones that they're behaving themselves and not driving you mad. Bye.